Hi everyone, my name is Paige Gibbings and I'm a Master of Nursing student at Athabasca University. My presentation today is titled Expectations of Bridging Bachelor of Nursing Students in the Final Clinical Practicum. The Final Clinical Practicum, or the CP, is a pivotal period in nursing education. It's the bridge between classroom learning and the realities of independent practice as a registered nurse or RN. During this experience, students are expected to demonstrate clinical competence, critical thinking, and professional judgment under indirect supervision. However, for licensed practical nurse to Bachelor of Nursing bridging students or LPN to BN students, this transition is especially complex. These students already have professional experience providing bedside care, but they now must shift into roles that emphasize broader clinical reasoning, leadership, and accountability at the RN level. This move represents not just a change in skill set, but a transformation of professional identity. While bridging programs have expanded across Canada, the educational research supporting them remains limited. Most studies still focus on transitional undergraduate students who enter nursing programs without prior license or work experience. LPN to BN students differ in a meaningful way. They juggle employment, family, and academic responsibilities. They bring confidence and technical skills, but uncertainty about higher level decision making. They often experience tension between their identity as experienced nurse and their new role as a student preparing for RN registration. When expectations about supervision, learning opportunities, or scope of practice don't match reality, frustration, role confusion, and anxiety can result. Understanding how these students form expectations before their final CP can help educators and preceptors design environments that better support their transition to independent practice. The purpose of this literature review was to explore how LPN to BM bridging students in Alberta form expectations for their final CP, and how those expectations shape the readiness for RN practice. I conducted an integrative review of 21 peer-reviewed studies published between 2015 and 2025 with a few earlier foundational works. 5 major themes emerged from the literature. The first one being bridging the theory to practice gap. Students entered the clinical placement expecting to apply classroom knowledge through hands-on experience, but many encountered a persistent mismatch between what they were taught and what the practice demanded. Bridging students in particular sought growth beyond basic skills. They wanted to strengthen clinical reasoning and leadership, yet often found themselves performing repetitive tasks. Students emphasized that this gap remains one of the most significant sources of frustration and self-doubt. The second theme is supportive environments and mentorship. Across the literature, the quality of mentorship emerged as a critical detriment of student confidence. Positive mentors created a safe environment for learning and critical reflection. Bridging students valued mentors who acknowledged their prior experience and guided them towards RN level competencies. When preceptors either underestimated or overestimated their abilities, it created tension and hindered progress. The third theme was professional identity formation. The clinical placement was a site for identity reconstruction. Traditional students were forming a professional identity for the first time, while bridging students were reforming theirs. They had to unlearn habits from the LPN practice while internalizing RN level autonomy, delegation, and critical thinking. This process is deeply emotional. Students described uncertainty about legitimacy and belonging. The fourth theme is emotional challenges. Anxiety and role ambiguity were consistent findings. Traditional students feared technical errors, while bridging students grappled with the loss of competence and status they once held as practicing nurses. Balancing family, work, and academics compounded this stress. Many participants described the practicum as both the most rewarding and the most emotionally taxing phase of their education. The last theme was structured preceptorships. Finally, students across many studies placed a strong value on structured, consistent preceptorship programs that offered clear learning goals and feedback. For bridging students, however, effective preceptorships required individualization, recognizing existing experience while scaffolding new skills. Yet barriers such as limited preceptorship training or workload often compromise these supports. These findings highlight the need for differentiated educational supports in bridging programs. Preceptors must understand the transitional complexity of this group, recognizing prior experience while fostering advanced RN competencies. Developing structured, individualized preceptorship models and early expectation setting strategies could enhance confidence, reduce frustration, and improve readiness for RN practice. In conclusion, the final clinical practicum represents more than just a placement. It's a rite of passage into professional identity. For LPN to BM bridging students, expectations are influenced by prior experience, emotional resilience, and perceived institutional support. However, mismatched assumptions between students and preceptors can hinder confidence and readiness. Ultimately, understanding expectation formation provides a pathway to smoother transitions, stronger professional integration, and improved patient care outcomes. Thank you for listening.